Well, the president, during his remarks earlier on from Kisii State Lodge, spoke about how the Taifa Care will greatly reduce the burden of healthcare in this country. But I think it's teething problems in the shift to the SHA may have perhaps been the highlights of the year that was in the health sector. That journey from the defunct National Health Insurance Fund, or NHIF if you like, remains challenging for many, though the government insists that all is well. The health docket also had 2 cabinet secretaries in 2024. Here now is a look at the hits and the misses in Kenya's march to the universal healthcare coverage in 2024.
October 1st, 2024 marked a new dawn as Kenya officially transitioned from the National Health Insurance Fund to the Social Health Authority, now referred to as Taifa Care. The transition came amid opposition, with some quarters arguing it was rushed, while the government maintained it was all systems go. After its launch, confusion was witnessed in various health facilities in the country, with patients seeking services stranded. While some were unaware of the transition, others had not registered and had to be turned away.
Tulikuja tu tukapata mambo ilibadilika. Hatukuwa tunajua.
Lakini niliambiwa wewe huwezi kupata matibabu leo, itabidi ulipe cash.
The requirement to first seek services at level 2 and 3 facilities before being referred to higher levels also raised an uproar.
If a patient lives, is a neighbor to the level 4, why should you force a patient to go 10 mileage to seek a referral from a level 3 and a level 2 to come to level 5? Meaning you are denying that patient accessibility to service, delaying intervention.
However, the government maintains that Taifa Care is the only way to ensure Kenyans access care regardless of their economic background. 2024 also saw Kenya report the monkeypox outbreak, with the number of those infected standing at 31, with 1 fatality recorded. The Ministry of Health took up the matter, heightening surveillance, while at the same time calling on the public to adhere to preventive measures, such as avoiding close contact with those infected and their belongings, regular hand washing with soap and water, minimizing sexual partners, among others. The ministry says that efforts are ongoing to secure a vaccine for the country.
And that is to protect the healthcare workers, the contacts of positive cases, truck drivers and commercial sex workers. It is important that they get vaccinated. And we are in the final stages of deliberating around the same, so that we can see whether we can get a few doses that can be used for the country.
The Ministry of Health was also put on the spot over a recent polio vaccination campaign, with the public expressing concern after some adverse effects were reported. The adverse effects put in the government on the spot over the safety of the vaccines used in the country.
I want to assure the public, any vaccine that is given to your children is okay. However, polio vaccine sometimes can react to a child, depending from one child to the other. Even you as a grown-up, there are some medication that may react to you, but that does not cause alarm. You should rush the child to a health facility to be checked further.
Following the expiration of the Medical Equipment Service Program in December 2023, which was embroiled in a 63 billion shillings lease scandal, a transition strategy was developed to maintain and enhance its gains. Under the new scheme, the National Equipment Service Program, 7 bidders were awarded contracts in October 2024. They are responsible for providing, maintaining, and upgrading equipment at no upfront cost to the counties, with payments made based on services rendered under the fee-for-services FFS model.
What we are really looking into is how we can achieve universal health coverage, affordable, accessible, quality of care to all Kenyans, and this is actually through provision of equipment. These are equipments such as those of dialysis, radiological equipment, maternal, neonatal child health equipment, among others.
However, the leasing scheme contract, which has been signed by the 7 counties, is said to have its pros and cons.
Anybody who says they were forced by the national government to sign whatever contract, those are conmen and they are liars. Because Mungaro is here Abdul Samad is here. Fatuma is here. They are governors. There is nobody who forced them to sign any contract.
The other notable controversy of the year is the resignation of Kenyatta University Teaching and Referral Hospital chairperson Professor Olive Mugenda after the hospital staff boycotted work, demanding her resignation from the facility. Other changes effected at the facility include the disbandment of the entire board. Kenyatta University Teaching, Referral and Research Hospital CEO Ahmed Dagane was also directed to proceed on indefinite leave. Dr. Zainab Gura was appointed to replace him in an acting capacity. On the 19th of December, President William Ruto appointed Kembi Gitura as chairperson, Board of Directors of the Level 6 Hospital. Nancy Okware, 2024 in Review.